Hi there.
Hi.
How's it going?
Good, I think.
What's going on?
I'm having trouble breathing and I don't feel good.
Okay, what's your name? Can you tell me your name?
Heather Hippa,
Okay, what's your date of birth?
July 30th of 97.
Oh, okay, where are you at, Heather? Can you tell me where you're at?
I don't really remember where I'm at.
Okay, how'd you get here?
Someone brought me in. I don't remember who it is.
Okay, do you know what day it is? What month it
No,
is?
I really can't breathe right now. I'm having trouble breathing.
Oh, okay, all right. We're gonna do a quick assessment. A lot of things are gonna be happening right now.
Okay.
Get some baseline vitals. We need a blood
Heather, I'm
glucose.
Nurse Shar. I'm a Joliet Junior College student nurse. I'm working with Randy today. I'm going to take all of your vital signs while Nurse Randy does your assessment, okay?
Am I going to be okay?
Well, we're going to do everything we can to make you be okay. Alrighty? Let me just get a quick blood pressure on you. It's going to get tight on your arm.
Okay.
Are you in pain, Heather?
I am in pain. My stomach hurts.
Okay, how
Right
bad?
here.
1 to 10.
Like a 4, 6.
Okay,
I don't know.
what kind of pain is it?
It's really sharp.
Sharp, is it always there? Does it come and go?
It's always there. It's just
Okay.
really sharp and it's just right here.
Okay. When did this start, Heather?
I noticed it today.
Okay, today?
Yeah.
Okay.
Can I put this
Just
on
this
your
little-
finger
yeah.
real quick? It's just going to tell me
Okay,
how
let me
well
check
you're
this real quick.
oxygenating, okay? How
Okay.
much oxygen is getting to your blood, okay? That'll just be on your finger for a little bit while I get your temperature, okay? Can
Okay.
you just put that under your tongue for me? Okay.
Squeeze my hands over.
Her blood pressure is 140 over 92, and her pulse ox is 93%.
Okay, we need to get some O2 on her.
Okay. Heather, we're just going to put some tubing on you. We're going to start a little bit of oxygen. This should help you breathe a little better. I see you're really
Okay,
struggling and breathing deep and rapid. So this will help. We're just going to put it right.
Okay. We need to start an IV, Heather, okay? You're a little dehydrated, I think.
Okay, is this
Okay.
gonna hurt?
No, no, no. You know, it'll just be a little pinch, but you seem like you're dehydrated here. Have you been thirsty?
I've been really thirsty.
Okay.
I've been very thirsty. I'm
Okay.
kind of hungry too. Can I have something
You know
to
what?
eat or drink?
Not right now. We want to figure out what's going on, okay, so we can make you feel a little better. Who brought you here?
I don't know. A girl I work with, I think.
Okay.
Okay, Heather, I'm just going to put some gloves on here.
Okay, Heather,
and,
we gotta start an IV on you.
I'm going to get a blood sugar on
Do
you.
some hand hygiene here.
Okay.
The friend that brought you in said that you're a diabetic,
Yeah, I am.
you're a type 1,
Yes.
so you're used to having your blood sugar
Yeah,
drawn.
I am.
Did you do it today at all?
No, I haven't done it in the last
Alright.
couple days.
Well, let's see what we got here today, okay? Okay, just a little stick.
When's the last time you ate, Heather? What'd you have?
A little while ago, I had a few cupcakes.
Okay, how many's a few? What'd you have? One,
like-
2?
Like 4, maybe?
Oh.
I don't know.
Okay.
Oh, boy.
So you had 4 cupcakes,
Yeah,
huh,
they're
Heather?
really good.
Well, that would explain a blood sugar of 615.
Oh, wow. Can we get something for the pain? My abdomen really hurts.
You know what? I'm gonna start an IV, okay?
Okay.
You look like you're really dehydrated, okay? We
Okay.
just wanna make sure in case we need to give you fluids, because your sugar's really high.
Okay.
So it's possible that you're a little dehydrated because your sugar's not gonna be able to go into your cells, okay?
Okay.
So, how long have you said you've been off your insulin? A couple days?
Yeah, just a couple days.
Heather, what I have here for you is we're just going to check on your heart rate, okay? Make sure these are just little sticky tabs, and it's
Okay.
just going to feed your heart rate and all and monitor you, see how your heart's doing, okay? Want to make sure you're safe, and that'll just stay in your pocket, okay?
Okay.
All right.
Just a little poke, okay?
Okay.
1, 2, 3, that's it.
Okay.
We're gonna have Dr. Dobbs come in, okay?
Okay.
He's gonna talk with you a bit more, then we can see what we can do about that pain,
Okay.
okay?
Your heart rate's a little fast, too. Might have something to do with your breathing as well. Okay.
Okay.
Hello, Miss Hippo.
Hi.
My name is Dr. Walter. What's going on? Why brought you to the ER?
Someone brought me in. I'm not feeling good. I'm having a hard time breathing. My stomach hurts.
Yeah, and when did that start?
It started earlier today. I'm not really sure. It's just been hurting today. It really hurts.
Okay, so what do you think is going on? You ever had this problem before?
Yeah, last time I had it, my blood sugars were kind of crazy. She said my sugar's really high right now.
Oh, is it? How high was it, nurse?
615, doctor.
All right, I'm just gonna go ahead and give you a quick exam here, and we'll see what's going on. Can I see your nurse's stethoscope?
Yeah. Okay, just, yeah, thank you.
Just gonna see you breathe real quick. Okay, all right, follow my finger. Just keep your head safe. Follow with your eyes, all right?
Okay.
Yep. Okay, thanks. All right, any swelling or anything in your feet going on?
No.
No? Okay, so I'm gonna put some orders on the computer, draw some labs, get some fluid going,
Okay.
and I'll tell you if I want to do anything else, okay?
Yes,
All right,
sir.
we're gonna take good care of you, ma'am. You said I see you're breathing fast. Is the oxygen helping?
A little bit, yeah.
Okay, all right. So, and how's your pain right now?
Like a 6 out of 10.
Okay, and we'll give you something for the pain. All right, my order is being the computer nurse. Okay, Miss Hippo, I'm going to draw an arterial blood gas and a lactate level, just to see how sick you are. And you're breathing kind of fast, so I want to see what the underlying problem is here. The problem is more extensive than we think.
Okay.
All right, so I'm just going to make sure you got good collateral circulation. All right, we'll clean this off here. All right, and down.
Ow! It really hurts.
Okay, well, we got it, so it'll just be done in a second.
It's a really long
so
second.
That. Now the lactate here.
Ow.
Great. Okay. Did you put these on ice
Yes.
and then go to labs right away?
Yes,
Also, this is an arterial stick, so I want you to hold direct pressure on
Yes.
this for at least 2 minutes.
absolutely.
All right, thank you. You're the nurse.
Hi Heather, it's me again. Just let me wash my hands really quick and just double check. Can you just tell me your name real quick
Heather Hippo,
and your date of birth?
July 30th of 97.
Okay, I'm just gonna get your vitals again, okay? We're gonna do another blood sugar.
Can I go to the bathroom? I really have to pee.
Can you wait until I finish your vitals real quick?
Sure.
Okay, and then I'll get you up, all right? We're gonna take it nice and easy because your body's still a little dizzy.
Yeah.
Okay, you know what? I gotta take it over here because he started the IV.
Okay.
Okay, we don't wanna take a blood pressure on an IV arm.
Okay.
Okay. Alrighty. Okay, this will be quick, Heather.
Okay.
Okay. Okay, it's still a little elevated. Let me get and your heart rate's still up. Let me just do a quick pulse ox. Thank you. And we'll get your temp real quick. Okay, yeah, your temp hasn't come down much. Your pulse ox still at 94. Your blood pressure's
Do you
still.
have a bathroom now?
Heather, I'm just gonna do a quick blood sugar on you, okay? Let me get my gloves back on.
Then we can go to the bathroom?
Yes, we'll go to the bathroom as soon as we get your blood sugar again, okay? Here, we'll pick a different finger. Okay, put that on there. Okay, you're still at 612, Heather. Alrighty, I will get you up to the bathroom, okay? We're gonna take it nice and slow though, okay? I
Okay.
have to take this off of you for just a little bit,
Okay.
okay?
Okay.
Alright, we're just gonna dangle you at the side for a little bit, make sure you're not too dizzy before we take you to the bathroom, okay?
Okay.
Alright. Okay, I can put this back on now.
Is he gonna give me something for my pain? My stomach still really hurts.
I'll see if they ordered something
How's
for
it
you,
going,
okay?
Heather?
Hi.
Hello, Miss Hippa. I'm here from the lab. I have to come and take some blood for some tests really quick, okay?
Okay.
We're just starting you on some fluids. Doctor said you're a little dehydrated. Okay, that can explain why you're really thirsty, urinating a lot, your sugar's so darn high.
Okay, can I get anything to drink at all?
You know what, not right now, okay?
When can I have something to drink?
We're gonna check with the doctor, okay? Right now, we just wanna keep nothing in your belly because you have kind of some pain there and some inflammation. So until things calm down a little bit, this will definitely help rehydrate you, make you feel better in the meantime, okay?
Okay.
All right, before I get started, could I just see your name band real quick? Can you give me your full name and date of birth?
Heather Hippa, July 30th of 1997.
Very good, thank you so much.
Does that feel
Okay.
okay?
Yeah, it feels
Okay,
fine.
no burning, nothing like that?
No.
Okay, good. All right, fluids have started, okay? He's gonna draw some more blood work, okay, and Dr. Norris some stuff for pain. Okay, so we can come back and it'll help the abdominal pain. We'll get you feeling better, okay, Heather?
Okay.
Now, is there any reason I wouldn't be able to draw some blood from this arm here?
No, not that I know of.
Okay.
What are you drawing
Okay.
again?
Well, I'm going to be drawing some labs that will give us a better picture as to how your kidneys are functioning, but
Okay.
also your electrolyte levels, your blood sugar, and different things like that.
Okay.
Okay. Just going to do a quick tourniquet. Okay. Just going to clean this up real good. All right, you're going to feel a quick pinch, all right?
Okay. Ah!
All right, just a little bit longer. All right. Just going to get some gauze on here really quick. All right, thank you so much, Miss.
Thanks.
Is there anything else I could get for you?
No, I'm good right now.
Okay.
Hi Heather, it's
Hi.
me again, time for vitals at 1500. Okay, can we double check your name band? Can you tell me your name?
Heather Hippa,
Good, and your birth date again?
July 30th of 97.
Great, okay. Just gonna check your pulse ox again,
Can you
okay?
give me that basin again?
Sure, you're still feeling kind of sick to your
Yeah.
stomach? Okay, you're still breathing awful fast.
Okay, Heather, your labs came back, your potassium level was a little low. This is just more fluid, your other fluid finished, but there's still a little potassium in it. Just to, it might be making you feel
How
a
do you know
little
my
weak.
potassium's low?
They checked your blood.
Oh.
When the lab technician came in,
Oh,
he checked
okay.
a little more than what we initially, or you were in phase.
And your EKG reading over here is kind of telling us you have a little bit of a low U wave. That's another indication that your potassium is running low.
Oh, okay.
Okay, just a quick blood pressure again.
Doctor did order that pain medicine, remember we were talking about for the
Yes,
abdominal pain,
yes,
okay?
awesome.
It's gonna go over in about 2 minutes, okay? We gotta make sure we push it slow. So
Just two?
yeah, just 2 minutes, okay? So, yeah, about 5 minutes there,
Okay.
okay?
Okay, thanks, Heather. Okay, can I get a quick temp on you again? Okay. Okay, it's down just a pinch, 99.
How's the breathing, Heather?
It's still really hard to breathe.
So, yeah, you're a bit clammy, are you?
Okay, I'm gonna get another blood sugar on you again, okay? Here we go, let's pick another finger. How about this one?
Sure.
Okay, little stick. Okay. Okay, her blood sugar is 607, okay Heather?
Still a little high, Heather. It's been about 3 minutes. That pain medication should be kicking in about 10-15 minutes, okay?
Okay.
And it should definitely help with the abdominal pain. I think Dr. Dobbs is gonna come in and talk with you soon. Oh, there he is.
Hi.
Oh,
Hello, Miss Hippa. So I've looked over all your labs, and based on what I see, I think you're in diabetic ketoacidosis.
Okay.
So your blood sugar is so high, it's causing all these problems, causing breathing problems, your peeing problems, all these problems. So we're gonna give you insulin, and we're gonna slowly bring down blood sugar.
Why can't you just give me insulin and then I can go like get back to work and?
Well, it's very important that we bring your insulin, your blood sugar level down very slowly. We're not gonna come down more than 80 an hour, all right? So you're gonna be here for a couple hours till we get that under control.
Why?
If we drop it too fast, we could cause a whole host of other problems up to and including brain swelling and even death. So we're gonna
Oh,
go
okay.
real slow just to get a handle on that. So that high blood sugar can lead to a whole host of other problems. So we're gonna bring that down very gradually. I think it would be best, I'm gonna admit you to the hospital, and we're gonna keep you here overnight, at least,
Okay.
maybe a day or two, just till we get all your blood sugar under control. All right, and
Okay.
you're not having any trouble breathing at all, but we're gonna take, don't worry, the nurses are gonna take real good care of you. I ordered some more drugs, and we're gonna do some more labs, but we're gonna get the insulin in, start going at 0.1,
Regular?
regular insulin, yes.
Okay.
And the nurse is gonna get on that right now.
Okay, Heather, we're gonna start this insulin Dr. Dobbs was telling you about, just regular insulin. We're just doing about 6 units per hour. Like you said, if we drop you down too quick, your body may not be used to it because you've been high for probably a couple of days or so.
Okay.
So just slow and steady, okay? And slowly you'll start to feel a little better, get a little strength back.
Hi Heather, it's me. It's the same
Hi.
drill. We're gonna do your vitals again, okay? Same thing, just tell me what your name is, your date of birth.
Heather Hippa, July 30th of 97.
Super, it's still you. All right, let's get your blood pressure.
How's the stomach feeling?
The pain feels better, but I still don't feel very good.
Nauseous kind of
Yeah.
feeling? Okay. Vomiting? Have you vomited?
I haven't really vomited yet, but I keep feeling like I'm going to.
Okay, her blood pressure is 131/79.
Okay.
Okay, I'm gonna get a quick temperature on you, okay? Okay. Your temp's still holding at 99, same as it was last hour. Let me get your glucose again, okay? You okay?
Yeah.
Are you just having dry heaves?
Yeah.
Do you have any family that we can call? Does anyone know you're here? Or do they think you're at work?
I have a friend who I was texting earlier.
Okay, she does know.
Yeah.
Okay. Okay, well, that's good. I'm glad to hear.
Okay, your blood sugar is still high, but it's down to 600 now.
Okay.
Okay, Heather, we're just gonna finish up on your vitals, okay?
Okay.
Okay. How's the nausea doing, Heather?
Still feeling really bad.
Okay. Doctor ordered some medicine, okay? It's called Zofran, okay? It's like an anti-nausea type of medicine. It's gonna run over about 2 minutes and push it.
Okay.
Okay, it's definitely gonna help with the nausea and that pain medicine helping a little with the pain, right?
Yeah, it is.
Okay, well, good.
Okay, just gonna do it again here. Little stick.
2 minutes. Good. We're gonna hand some more fluids, okay?
Okay.
Okay, Heather, your blood sugar's down to 540 now.
Okay, 540. Okay, that's down a little, which is good. We're gonna keep you at about 6 units an hour though still, okay?
Okay.
Okay, we're not, like the main thing, like Dr. Dobbs was saying, we don't wanna drop it too fast. Okay, but we're going in the right direction, okay? Pain's under control, okay, that nausea is gonna be less and less, and the sugar's gonna keep dropping. We're gonna keep kinda doing the same thing,
Okay.
okay?
Okay, Heather, I've got your vitals now. I just need to do another blood sugar on you.
Okay. Did we say no?
Yeah. Getting tired of me doing it on the other hand? Okay, here we go, a little stick.
How's it going, Heather?
Good.
Let me know that blood sugar, Shar.
Okay. Okay, it's 480. Your blood
480.
sugar's 480, Heather. Getting there.
How's that feel, okay?
Yep.
Everything is good, looks good. Sugar's going down. Okay, sugar's going down. We're gonna keep you though. 6 units.
Okay.
Seems to be working. Each time, we're gonna check hourly. Continue to try to do the same thing. But
Okay.
you feeling any better? How's
A
pain?
little better. I'm still in pain.
Okay.
It's starting to come back a little bit.
Okay. All right, and what about, you still thirsty?
I'm still really thirsty.
Okay, we can see if doctor wants to give you some ice chips or something, okay?
Okay.
Okay, so you said you're having some pain there
Mhm.
still? Okay, 1 to 10.
Probably
at-
like a 5 now.
Five.
Starting to get back up there.
Oh, okay, 5. And it's comes and goes in waves, or is it
No,
always
it's
there?
still just there.
Okay, same spot?
Mhm.
Okay. Okay, Heather, we got you dilaudid here. It's what you got before, okay?
Okay.
You said pain was running about 5 now, huh?
Yeah.
Okay, this one's gonna run about 3 to 5 minutes. I'm just gonna stand here, okay? And
Okay.
it should definitely bring you back down, okay?
Okay.
What's your date of birth?
July 30th of 1997.
Okay, and your name?
Heather Hippa.
Okay, Heather, that's it for your vitals. I just have to do your blood glucose again.
Okay. Can I go to the bathroom?
Sure, how about if I do this first and then we'll go to the bathroom,
Okay.
okay? And remember, when you're up at the bathroom, you still need to urinate in that little hat, okay? So we can keep measuring your urine.
Okay.
Okay, good job. Okay, we'll get up nice and slow here, okay?
Okay.
I'll take this off real quick. Okay, Heather, real good. Do you feel better now?
Yeah, a lot better.
Good.
How's it going, Shar?
Good. Her blood sugar was 420.
420?
Yes.
Okay, okay, well, we're coming down, all right, which is good. Okay, we're gonna keep you about 6 units an hour, all right? Lab, I think I seen lab coming, they're gonna redraw your potassium level. Remember how we told you about the potassium?
Yeah.
We're gonna recheck it,
Okay.
see if it's working, see if
Okay.
everything's helping.
Hi, Miss Hippo.
Hi.
I'm back again. Your doctor ordered some repeat labs. I'm just gonna draw those up so that they can see how your kidneys are doing and your blood sugars
Okay.
and also your electrolytes, okay?
Okay.
Yeah, hey, Jen? Yeah, it's Randy in emergency. Yeah, we have a patient here, 19-year-old female. She presented today, her coworker dropped her off actually, left her here. She was alert to name with some aphasic speech and some impaired coordination. Extremely thirsty, urinary frequency, nausea, vomiting, and abdominal pain. Initial glucose was above 600. Dr. Dobbs came, seen her, started on some fluids. We are going to admit her. Dr. Dobbs does want to keep her over for observation. She does have a positive history for insulin dependent DM. Actually, no other pertinent medical history. Initial assessment on her, she did have fruity breath confusion, skin was warm and dry. Initial glucose 615, vitals, she was 140 over 90, heart rate tachy 125, resp 30 in labor, low grade fever 99.2, sats were 94 and room air doctor we started on 2 liters nasal cannula. So far she's gotten some Dilaudid for the abdominal pain and some Zofran from nausea. Last glucose we checked was in the 400, so she is coming down, but we're just going to kind of bring her down slowly. But doctor wants to admit her on med-surg just for some more observation and hydration. So I'll send her your way, transportation, I already called them, so she should be heading up your way in about 10, 15, 20 minutes or so. Okay, thanks, John.
Okay, Heather, we got you up safely to your room.
Hello.
Hey, John.
Hi.
This is
Heather?
Nurse Jen.
Hi, nice to meet you. My name is Jen. I'm going to be your nurse up here taking
Okay.
care of you. How are you feeling?
I'm feeling a lot better now.
Good, good. I'm glad they took good care of you down there. Okay, so I just had some questions about report. What fluids does she have running right now?
She's just got some 09 points, 09 saline, 125 an hour.
Okay,
She got some potassium,
Okay.
20 MEQ,
All right.
potassium was a little low.
all right. Are you having any pain, Heather?
I'm okay right now.
Okay, does she have anything other for pain in case she needs it?
She had, yeah, she got some Dilaudid earlier.
Okay.
Highest she got was at 6, went down to a 5, stayed there. We did give her some Zofran, so she's having some nausea.
Okay, what time was her Dilaudid last given?
1600?
I believe it was 1800.
1800? Okay, I'll double check in the chart just to make sure. We're gonna get a set of vitals and check your blood sugar again, just to see what we need to do with your insulin rate, okay?
Okay.
Nurse Jen, you get me for the rest of the night. They floated me up with Heather. I'm gonna stay with her. I'm hoping to do my case study on her for school.
All right, well, if you need any information, just let me know and I can help you get that stuff.
Awesome, thank you.
You're welcome.
Do you want me to do those vitals for you?
Yes, please, if we could do the blood sugar first, just so I can.
Oh.
Thank you, Nurse Randy, have a good night.
Yeah.
All right, Heather, can you tell me your full name and date of birth?
Heather Hippa, my birthday is July 30th of 97.
Perfect, thank you. And you said just a little bit of pain right now, not too bad?
Yeah, not as much as it was before anyway.
Okay, if you do start having more pain, let me know. You are due for that Dilaudid again if you
Okay.
need it, okay? I'm gonna put a call into your primary doctor so I can give orders. So,
Okay.
have you eaten anything yet?
No, I haven't.
All right, so I'll get orders to see if we can feed you, and what we're gonna do, what our plan is for the rest of the night, okay?
Okay.
Her blood glucose is 360.
Okay, 360. Well, we're gonna keep you at the 6 units an hour.
Okay.
Okay, it's coming down nicely though. And I will be back in to do an assessment on you and let you know what the doctor says.
Okay.
Okay?
Yeah.
Thank you.
Thank you.
Hi, Dr. Dobbs, this is Jen from the medical ICU. I'm taking care of your patient, Heather Hippa, in room 3002. She's been admitted to us with DKA. She arrived in the ED at 1300 with altered mentation and a blood glucose of 615. They did start her on 0.9, and she also had 20 MEQs of potassium earlier today for a potassium of 3.1. We also started her on a Novolin drip per protocol. Her vitals are stable. Dilaudid and Zofran have been ordered. Those seem to be working well for her. Her last potassium was 3.3 at 1900. Vitals are stable, with the last blood pressure being 124/75 and her blood glucose at 360. I'm just hoping to get some admitting orders, maybe switch her over to D5.45. Would that be okay?
Oh, yeah, that sounds great. Why don't you switch over to the D545 at, what do you think, 125?
Sounds great to me. And what about some Tylenol for mild pain? Maybe try to get her off the Dilaudid. What do you think?
Oh, that's a great idea. Well, what dose do you think she's been getting for the Dilaudid?
She's been taking about 1 milligram every 2 to 3 hours as ordered.
So you think, what, 500 for the Tylenol?
Perfect, yep. And maybe some prophylactic protonics.
Sounds great. I'll put it all in the computer. Do you think we need anything else?
Yeah, I was wondering if you wanted any repeat labs, a BMP in the morning maybe?
Yeah, that's great. Why don't you do another repeat BMP so we can check on that
Okay.
potassium?
Perfect, and then she's requesting to eat. Can we advance her diet as tolerated? She's been NPO.
Yep, sounds great. And I'll put in an order for the dietitian.
Okay, I'm sorry, go ahead.
No, anything else?
Yeah, I was wondering if she can be up as tolerated. We've been keeping her in bed.
Oh yeah, she's got a steady gait alert.
Usually, it's a little unsteady sometimes, but she's got a helper with her.
Okay, then as long as I think that's up to tolerated, as long as there's somebody with her.
Yeah. STD's well in bed?
Yes.
Okay, and you said you're putting in for the diabetic educator to come see her, correct?
Yes.
And can we also get an endocrine consult? She doesn't have one.
Oh, all right. Well, do you know who her normal doctor is?
She hasn't been seeing one.
Oh, okay. All right, then I'll put in for an endocrine consult.
Perfect, and then once we have everything stable and under control, do you mind if we resume her home meds?
Oh, sounds great. Why don't you, you're the nurse, put that in to effect and I'll write all those orders. They'll be in there momentarily.
All right, Dr. Dowd, I just want to make sure that I have all your orders correct here. So we're switching Ms. HIPAA to D5.45 at 125 mils per hour. Tylenol 500 milligrams, Q 6 hours as needed for pain. Prophylaxis, Protonics 40 milligrams, IV push daily. Repeat BMP and AM. Diet, advanced is tolerated. Activity up is tolerated. SCDs while in bed. Endocrine consult, diabetic educator consult, and resuming home meds. Is that correct?
Yes, nurse, that is correct, and I'll make sure that they're in the computer for you ASAP.
Okay, thank you so much. Hi Heather, it's just me again.
And me.
Char's here, she's gonna check your blood sugar and your vitals again for me. I just wanted to let you know that I did talk to Dr. Dobbs, got some orders for you. We're gonna be switching your IV fluids over to something different. That'll help the insulin kind of get into your cells and help bring your blood sugars down a little bit easier, okay? We got some Tylenol ordered in case you're just having some mild pain and you don't want it dilaudid.
Okay.
We got another medication to help protect your stomach while you're in here so you don't get any ulcers.
Okay.
We're gonna repeat labs here. They should be coming very soon to check your potassium again. And then they're gonna be checking it again in the morning. We did get a diet ordered for you, so Char can grab you some ice chips. We'll start there just to make sure that you're not still getting sick. And we can advance you as your stomach is tolerating it, okay?
Okay.
You can be up to the bathroom with help. And we have some STDs that we're gonna put on your legs, and what they do is just help the blood flow get back up to your heart so you don't get any blood clots.
Okay.
I noticed that you don't have an endocrinologist, so we did get a consult to have one come in and see you, and also the diabetic educator to kind of help you plan a little bit easier with your meals, okay?
Okay.
So I'll let Char do that. I'm gonna
Okay,
get your
Heather.
fluids switched over.
Can you just tell us your name
Yes.
Heather HIPAA,
and the date of birth?
July 30th of 1997.
That is correct. Okay, I'll just get your vitals done again, just like always.
Okay.
How's your blood pressure?
Her blood pressure is 119/72.
Perfect.
It's getting much better.
All right. We'll just see what your blood sugar is and see what we got to do with your insulin.
Okay, her blood sugar is 300.
Perfect, okay. Looks like we're gonna bump you down to 4 units an hour, so that's fantastic, okay? So we'll get that switched over and then we'll check you again in an hour, okay?
Okay.
Do you need anything else right now?
No, I think I'm okay.
Okay, perfect.
You don't have any more questions for us about anything?
No?
Okay, great. We'll see you in an hour.
Okay.
Oh, I need to put your STZ done real
Okay.
quick.
Hello again, Heather.
Hi, Nurse
Sure,
Jen.
Thank you.
I just got done taking her blood sugar. It's down to 240,
Okay,
and her pulse ox is 99%.
okay. How is your breathing feeling? Pretty good?
Feels
You still getting a
better.
short breath?
No, I don't feel quite that, not the same anymore.
Okay,
I feel
well,
a
how
lot
about we
better.
take that off?
Okay.
That sound okay?
Yes.
Okay. We'll just keep an eye on that if we need to put it back on, okay?
Okay.
All right, and you said 240?
Yes.
Okay, so let's see what we're doing here. We're gonna bump you down to 3 units, okay?
Okay.
We're going in a good direction here. There we go. All right, and then we will be back in an hour to see what it is. How are you
Okay.
feeling? Any pain yet, or?
No, I'm okay. I feel better now.
Okay, wonderful. Well, let us know if you need anything. Hello, Heather, it's just me
Hi.
again.
Okay, I just finished up her vitals again for this hour,
Okay.
and her blood glucose is 180. Heather, you're really coming along nicely.
180, 180, let's see. What was her SpO2? How's she doing without the oxygen?
99% on room air.
Perfect, wonderful, we'll leave that off then. Down to 2 units an hour, so we're moving in the right direction. Hopefully we can get you into range soon, and then maybe move your blood sugars back to every 2 hours that we're doing them.
Okay.
I think Will from the lab is here to do your,
Hello, Miss
I'm
Hippo.
sure you're starting to feel like a pincushion, aren't you, Heather? All right.
hello.
Oh, hi, Nurse
Hi.
Jen.
Hi, Cheryl. How's
Just-
it going?
Good, just finishing up on her vitals again. Her
Okay.
blood sugar is 120.
Perfect. All right, how's our vitals?
Her temperature is down to 98, her heart rate is 90, her respirations are 14, her blood pressure is 116/70, and her oxygen level is 99% on room air.
Perfect. All right, blood sugar of 120, that puts us in our goal range. Yeah, that's really good. So we're gonna bump you down to just 1 unit an hour,
Okay.
and we're gonna keep that going for a little bit. We'll recheck your blood sugar in 2 hours now, and see how your blood sugars are maintaining and see if they stay in range.
Okay.
Okay? Did you need anything else right now, or are you doing okay?
I'm okay.
Okay, perfect.
See you later, Heather.
Bye. Hi.
Hello, I'm Lisa.
Hi.
I am a diabetes consultant to come see you today.
Okay.
How are you feeling?
I'm feeling a lot better.
I heard you've had quite a day yesterday.
Yes, I did.
I'd like to take, I brought some information. Here I've got a pamphlet for you to take a look at. While I discuss what diabetes is. Diabetes is a condition that your body gets when it can't use the glucose from the food that you eat
Okay.
correctly. You have type 1 diabetes, and that's when the pancreas doesn't make enough insulin, or any insulin, for it to move the glucose from your blood into your cells.
Okay.
So how you can tell whether your glucose is controlled or not is by an A1C level. Have you ever heard of that before?
I've heard of it a little, yeah.
Okay, so on here, we've got your A1C levels came back at a 10.
Okay.
So what that's gonna be approximately, to convert it, would be 240.
Okay.
Is your blood glucose level on a regular basis.
Okay.
And what happens is the sugar actually sticks to your red blood cells, and that's how they can measure your A1C level.
Oh,
Your blood
okay.
cells only live for a certain amount of time, about 90 days, so that's how they can tell how high your levels are, is because of how much sugar is stuck to those blood cells before they die
Okay.
and are destroyed. So, the first thing that's kind of the most important thing is to know what sugar comes from.
Okay.
Most of them come from carbohydrates. And if we take a look in this one, we've got a big long list of foods. How many carbohydrates we should have during the day is basically non-existent anymore. What we want to do is spread the amount of carbohydrates that you have throughout the run of the day,
Okay.
okay? So going out and eating one big giant meal to max out your carbs is never a good idea. You
Okay.
always want to make sure that you keep it on a nice level keel. We don't want big ups and we don't want big downs.
Okay.
So the number of carbs that we would like you to have approximately is between 45 and 75 per meal,
Okay.
and snacks between 15 and 30.
Okay.
So 1 portion of cake with frosting on it is 1 square inch.
Okay.
Okay, and how many cupcakes did you have?
Like 4.
Okay, so let's say 1 square inch of a cupcake
Okay. It's a lot less.
is 1 serving. So let's say 1 cupcake is maybe around 4 servings.
Okay.
So times 4, you had many, many servings of cupcakes, which put you here.
Okay.
I'm going to hang that on the refrigerator. And then there's also a self-care book here that I have for you. It's going to give you all the information that we've already gone through in much greater detail.
I hope you've enjoyed our simulation, but always remember,
You're the nurse.